Hi there, Dr. Darrow.
Hello, Anita. Are you living it up today?
I am living it up. I've learned it from you. Always live it up.
May as well. It beats working.
Well, this doesn't feel like work, but what we are going to do today is have people call us who are in musculoskeletal pain. What the show is about is helping you avoid surgery. Our byline of the show is take the surgery out of pain. Muscle pain, joint pain, tendon pain, ligament pain, disc pain. That includes neck pain, back pain, arthritis pain, all kinds of stiff joint pain, dull aches, tendonitis, anything of that ilk. That's our topic today. You can call all hour long at 866-870-5752. And when you phone the program, you get a free book, Dr. Darrow's latest, called Stem Cell and Platelet Therapy. Subtitle, Regenerate, Don't Operate, which has 264 studies, actually, that give you all the research you need to know. That is probably a brand new paradigm. You may not have heard of it, but it's been around for decades. Right, Dr. Darrow?
Well, it's been around for over 100 years, really. It's just that it's morphed into the most recent stage, which is using stem cells and using platelets from your own body. That's called PRP, platelet-rich plasma. But back in the day, 5,000 years ago, the Chinese were using it with heated needles to, in a sense, scald the collagen and heal areas like that. When we irritate the body with any type of an injury, whether it's self-induced or done by nature, it actually brings fibroblasts to that area, which are cells that produce collagen. And collagen is a primary constituent of cartilage. So what we're doing is regrowing the body. We're rejuvenating it. We're making people happy again. And it's been on the planet forever, really. And then in about 500 BC, we had a gentleman named Hippocrates who was a healer, and he used a very crude form with the Olympians. The ones who were using javelins were dislocating their shoulders, and he would scald the axilla, or the armpit, and scar it up so that they had decreased range of motion and therefore decreased dislocations. Now, I had a girl come in yesterday who had dislocated her shoulder. With the dislocation, all typically will come a dent into the humeral head, and she had that also, about 7 millimeters. And orthopedic surgeons will often tighten up the joint capsule so you decrease the range of motion, but then you've got a shoulder that doesn't move as well. And I've seen a lot of people come in who have had this capsular reduction, as we call it, and still had dislocations. And I've been able to help them tighten that shoulder up using platelets from their blood or stem cells from their bone marrow or umbilical cord stem cells mixed with their own platelets from their blood. It usually takes about 3 treatments to tighten it up. Very simple. So if your shoulder is a dislocator, you may want to bring it in. If you want to find out if we take your insurance, you can call us at 800-300-9300. I'll repeat it while you're grabbing your pencil. It's 800-300-9300. And we would love to get your call. We love taking calls. We love our callers. And unfortunately, most people wait till the end of the show and then we have a full board and we can't talk to you. But if you want to call into the show right now, that'd be a great idea. Our number at the show, get your pencil, 866-870-5752. I'll repeat it, 866-870-5752. And you can talk to me live.
And it's almost like a free consultation. I love this idea. 866-870-5752. And remember, you get a free book when you call, and also check out the website at www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site. You can also see him performing the treatments on video. And we want everybody to follow the title of the show, which is Living Pain Free. See, we want you out of your chronic pain. Chronic pain is, 90 days or more?
Well, chronic is a timing, just like acute is a timing. So if you have pain that's brand new, whether it be intense or not intense, that is called acute pain. Chronic is typically about 90 days or more. But we help people with acute pain or chronic pain. It doesn't matter.
Again, that number is 866-870-5752. And Dr. Darrow has tons of correspondence and questions that come in to him around the clock. And before we get to that, I want you to know that if you listen, you might learn something that is relevant to your problem. But you will absolutely be so much more on target if you call us and talk about it. And also when you call, you're speaking for other people that you don't know about that also share your type of pain. So give us a call right now. I have lines open for you, 866-870-5752.
Thank you, Nita. I want to talk about a couple things.
Okay.
I had a woman come in 2 days ago who had knee pain, which I think was caused by her overweightness. And I didn't want to use the O word. You know what that O word is, Nita?
Obese.
Yeah. And when I mentioned that her arthritis in her knees probably came from the fact that she carried a lot of extra weight, because we know every pound extra is about 4 pounds of biomechanical pressure on the knee. So if you're 40 pounds over, that's about 160 pounds extra pressure on each knee every time you stand up. And she wouldn't hear it. Every time I brought it up, she started talking about a family situation. So she never even got to talk about the diet we have, which is called Ideal Protein. She just would not go there, and I feel bad for her, because we can still treat her, we can still help her, but it's not going to be as complete or fast a healing as someone who can be thin. And it's easy to be thin. Our diet will help people lose about 15 to 20 pounds per month. So if you have hip pain or knee pain or leg pain or foot pain, arthritis on the foot, whatever it is, you ought to think about doing that. And then for people who want to get prettier, my wife, Michelle Darrow, who is a very pretty woman, does something. She's a nurse practitioner that's called the vampire facelift. And she does what I do on the face, but I do it on the body, which is to grow back the tissue. And she does it by injecting platelets or stem cells into the face. And it's an amazing procedure. People look great. And I admonish people to try it. People always look at me and go, well, you look so young. Did your wife work on your face? No, I got great genetics. I've got, she hasn't had to work on me yet. The day will probably come, though. Nita, did you want to go to the caller we have here?
Yeah, I want to go to David in Whittier right now.
Okay. So, David, your wife has lupus. By the way, there's Dr. Marc Darrow, David, and she has a torn meniscus. So the lupus is not something I can help with. That's a rheumatological disease where the cells of the body are attacking the body. And the one thing I can tell her that might help her is getting on an alkaline diet. I'll let you look that up on Google, and all the alkaline foods and all the acidic foods are listed. So she would get off of grains and dairy products and alcohol and sugar. But you can look that up. And as far as the torn meniscus, how do you know she has a torn meniscus?
Pardon me?
How do you know her knee has a torn meniscus?
Oh, she had 2 arthroscopic surgeries in the past
Okay.
prior to being diagnosed with lupus. And now at the young age of 55. She needs a cane, and if we go any place long distance, I have to use a wheelchair because she has limited mobility as far as walking.
Okay.
So it was not so much the lupus that I was telling you about, but her knee pain
Gotcha.
in both knees. And
Gotcha.
she's got some degeneration in the cartilage, and that's the reason I called.
Excellent. That's the kind of thing that we help all day long, and we take care of pain all over the body. Meniscal tears are things that most people have by the age of 55, if they've been active at all. And then when they tweak their knee, it could be in their sleep or something, they wake up and it hurts or it's swollen, and they go to a doctor, he does an MRI, and he goes, you have meniscal tear, let's operate, when it wasn't the problem to begin with. And so
right.
when...
And, I don't know, which is why I called you, but the reason I mentioned the lupus is I wanted to know if that would have any bearing on the treatment that you provide.
No, lupus doesn't block me from treating someone. Any other questions?
No, I think you've answered them. I do want to make an appointment. A good friend of mine that I golf with, Mike, has been to see you with his wife, Pat.
Oh,
and,
yeah.
Aside from listening to your show on a regular basis, I do know people that have used you and swear by you, and I'd like to make the same appointment for myself and my wife.
I took Mike out to Mountain Gate to play. He's a great guy.
That's
I
what
love
he told
him.
me, but he loved it.
Yeah, he's a wonderful person. He's one of the nicest people on the planet. Same thing with his wife, and they sent in his son, who's also a wonderful person. They have a great, great family.
Well, thank you. I let him know you said that.
Yeah, and they've all had great success with my treatments, thank goodness, huh?
Well, I know what he was telling me. Pat could barely walk until she started seeing you. And she went from maybe walking 2 doors to walking around the block, and she's doing much better.
Well, congratulations to her. God bless you. I appreciate your call, and thank you so much, David.
Thank you, David. Our number is 866-870-5752, and we're going to Irene in Torrance.
Irene, Dr. Marc Darrow, I understand that you have inflammation in your thumb and wrist. That hurts, doesn't it? I've had it.
It's been a year I've been listening to you, and today I have the courage to call you.
Good girl. Thank you. So that's very...
This inflammation, yes.
It's very common, what you have, and typically it's very easy to fix. And as a matter of fact, I've fixed my own wrist, and that was about 50% better the day after it was first injected. Now, people laugh because I inject my own body. So I have injected my wrist, I've injected both my elbows, I've injected both my shoulders, I've injected both my knees. When I've had neck and back pain injuries, I've had other people do that because I can't reach around my neck or back to do it safely. But anything on the...
actually the thumb, somebody's actually toward the end of the thumb.
Okay, yeah. That's very common, and we treat that almost every day. It's very common.
Because I spoke to my doctor, said, no, you are old, and, these things like that don't work for you. And I said,
no, it should work. I can't promise anything to anybody. But, yeah, we do those every day, and we get great results. All we're doing is stimulating more tissue to grow and rejuvenate the area. It's not rocket science. It's pretty easy to do. We would just use on your thumb, depending how bad it is, either PRP, which is platelet-rich plasma, taking your own blood and spinning it and throwing away the red cells because they hurt, and just injecting the platelets.
Years ago, I did something different. I had about 8 years ago, I had some pain on my knee, and it was hurting. So they gave me this injection of sore pads. I said, I don't think it works. You know what, doctor? I had 3 of those, and it works.
Okay.
I don't know what that injection was. Well,
congratulations.
I don't know, something from the rooster, like the press from the rooster.
I see. That's called hyaluronic acid. And I'm glad that worked for you. It works a little bit for a while on a lot of people. I don't use it because it's not going to fix anything. I'm interested in rejuvenating the area, actually fixing it. So the work that I do is called regenerative medicine. I don't want a Band-Aid.
Okay.
I don't use steroids, and I don't use hyaluronic acid. Okay?
Okay, well, that sounds good. So I guess what I'll do, I'll make an appointment, and I'll see what happens.
God bless you. Thank you very much, Irene. I want to give out our number so other people can call in. We've got a couple others waiting. But if you want to call in and talk to me right now, our number at the studio is 866-870-5752. I'll repeat it for those of you running to get a pencil. 866-870-5752. And if you want to get an insurance verification from our office, you can do that right now. We have people by the phones, and our office number is 800-300-9300. We do take Medicare, Cigna, Aetna, Blue Cross, Blue Shield, United Healthcare. And for people without insurance, we can help you get a credit card for medical procedures, which we call Care Credit. So give us a call at the office or give us a call on the show.
Perfect. And that number again is 866-870-5752, 866-870-5752. And check out the website at www.lastemcells.com. That's lastemcells.com. And we're going to go to Chris in Valencia.
Hey, Chris, Dr. Marc Darrow, I understand that you're trying to lose weight and it's not working for you. So how much do you weigh, if I may ask?
I weigh 220 pounds.
How tall are you?
5'9".
Okay.
With my shoes on.
You're cute. So losing weight is very easy to do, and there's a couple ways you can do it. Number one, we have a diet in the office called Ideal Protein. And on the Ideal Protein diet, people lose about 15 to 20 pounds. Write down this phone number. You can call and ask for Nicole, and she will see you. She's our diet coach. And the number to the office is 800-300-9300. So that diet puts you in ketosis, in a state where you eat your own fat. So you're never hungry when you're doing it. The other way you can do it on your own is to cut out all your carbs except from those from low glycemic index vegetables.
Oh, I've tried that over and over, and I don't do well at it.
Well, most people don't. That's the one I do. I tried the Ideal Protein diet, and in 1 week I lost 7 pounds, and I started at about 170, and I got down to 163. I'm about 6 feet, so I'm skinny to start with. But you can lose the weight. It's very easy. Everybody who does this diet loses the weight. It's very, very simple. You can't lose, but you'll lose the weight.
Yeah, I'm very much looking forward to it. I listened to your show for an awfully long time, and I finally got the courage to call, and I appreciate your
cool.
time.
I'm so glad you did that.
An awful lot of us out here, thank you for what you do.
Thank you so much. You'll be skinny soon. Just give us a call.
I will. Thank you very much. Keep up the
All
good
right,
work.
Chris. God bless you, man.
Thank you, Chris. Appreciate the call.
Thank you. Bye-bye.
Bye. You're listening to Living Pain-Free with Dr. Marc Darrow. Our call-in number for you to talk about your chronic musculoskeletal pain is 866-870-5752. That's 866-870-5752. What do you think, Dr. Darrow?
I think I'm going to answer a question.
Okay.
So this just came in. Would like to explore stem cells for both knees. I assume this person didn't say very much, but I assume they're having pain in their knees or arthritis. And the stem cells are the most efficient way to heal that and to grow back tissue. We see x-rays before and after with growing cartilage. And most of the time, people don't want to get an x-ray or an MRI afterwards because they feel good. And I wanted to do a study years ago showing photographs before and after, but I couldn't get enough people to go back to the radiologist. They said, why should I? I feel good. I don't care. I don't care what it looks like. But the stem cells mixed with the platelets are an amazing process. I've done it on myself. I've done my knees and my shoulders. I've had great success. I love it. What can I say? I love going to the office every morning. People think this is funny. They go, you need to take vacation time. In 2017, 2 days off. Yeah, 2018, I think I took 4 days off to be with the family. I love what I do. What can I tell you? There's no happier situation for a guy to be in than to watch people heal. And there's some days I come in where people are so grateful that it just lifts me. And I love that thing. It's actually, I mean, this sounds strange, but I was ordained in 1973 to do this work before I even knew what it was. I was told I would be doing it, and I got a spiritual blessing to do it. And then it showed up many years later, and I found out what that blessing was all about. So I know I don't do the healing. I know that comes from spirit. And some people have a hard time understanding that, but most people get it. Most people that come to me are, I think, drawn to the spirit of my office, and they come in and they go, I can't believe you and your staff. This is not like a medical office. And we try to keep it like that. We try to keep it as more of a healing center. I don't walk around saying I'm a healer, but I do get to walk around and say I get to watch people heal, and that's the greatest gift that I could have. So yeah, I think these treatments are the greatest thing for healing knees. I've got another question here about hips. Yeah, but let's get some callers in here.
Okay, well, let me give the phone number, 866-870-5752, 866-870-5752. We're about nearly halfway through the hour. The time goes quickly, so call now. Every week, Dr. Darrow, we get a stack of calls at the end, and then we run out of time, and I don't want you to be disappointed, so please call now. I have lines open for you right now, 866-870-5752. It's a good thing we're not in Europe where they make you take a month off work. You would go crazy.
I would. I wouldn't like it.
You wouldn't. I get it. I wouldn't like it either. I get that. So that's what we've got for you today is a possible solution for your chronic musculoskeletal pain. So if you're suffering with muscle pain, joint pain, disc pain, neck pain, back pain, knee pain, arm pain, wrist pain, elbow pain, hip pain, I think I can name all the parts of the body. I'm not going to, don't worry. So 866-870-5752.
Also, I just mentioned that, I will take a question, but okay. I wanted to mention that for those of you that want to email me, and I get emails all day, all night, I answer every one of them, go to the website. It's got a spot on every page to email me, and the website is www.lastemcells.com. Simple. www.lastemcells.com. I'd love to have your emails, but I sure would like to hear from you. It's more fun. So here goes one. This is an email that came in. My husband has been advised for hip replacement, but we found your website, very much interested and would like to know more. So yes, these procedures work. Hang with us and we will get to the rest of this question after the break.
You're listening to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens. Grab a pen or a pencil, write down this important information about to come your way, and we'll be right back after these messages.